Good afternoon. Welcome to our webinar. Thank you all for joining us. My name is Michigami, and I'm pleased to be the facilitator today. I'm the Secretary General of TCS, Trilateral Cooperation Secretariat. TCS is an international organization established by the three governments of China, Japan, and Korea in 2011. Today, we have three distinguished speakers from China, Japan, and Korea. Also, Dr. KASAI from WHO as a special guest. Now, let me invite Mr. Gumbert, Head of UNESCAP East and Northeast Asia Office, for opening remarks. Excellency.
Thank you. Warm welcome to you all. Good afternoon from UNESCAP East and Northeast Asia Office here in Incheon, Korea. I'm delighted to welcome all of you to the webinar jointly organized by TCS and our office. Thank you for your support. We have received over 2,000 registrations from more than 70 countries. Before I begin, please allow me to extend my personal wish to everyone that you and your family are keeping safe and healthy at this difficult time. The COVID-19 pandemic has brought unprecedented challenges to the world. Following the outbreaks of COVID-19 over the past months, countries are now moving towards the second phase of the pandemic, where social distancing and prevention measures are kept in place while resuming and reopening economic activities to the extent possible. The journey back to recovery is not easy. Countries must resist the urge to go back to business as usual. With the countries that have been dealing with COVID-19 the longest and having achieved a degree of success in containing risk, China, Japan, and the Republic of Korea have been paving the way for other countries in terms of managing the pandemic. There is a small window of opportunity for the three countries to lead the global recovery efforts. Today's discussion will highlight their experiences and best practices, as well as areas for possible joint activities to build back better together. UNESCAP firmly believes that this crisis can be taken as an opportunity to reorient the development approach. With this in mind, we will focus on three streams of works. First, supporting economic recovery. Second, protecting people and enhancing resilience. And third, restoring supply chain and supporting small and medium enterprises. As the United Nations Secretary General Antonio Guterres said, we are only as strong as the biggest health system in our interconnected world. Solidarity is the only way to win the war against the virus. While China, Japan, and the Republic of Korea have demonstrated concrete strategies on managing the pandemic and promoting sustainable recovery, I hope we will have fruitful exchanges in the coming 1.5 hours, thereby distilling ways to build back together at this challenging time.
Thank you, Excellency. I'm also very delighted to co-host this meaningful milestone event with UNESCAP. We hear many voices of many countries that they want to know more from China, Japan, and Korea about their response to COVID-19. This webinar is to share our experiences and learn together. I express my deepest condolences to those who have lost their loved ones. My respect goes to the frontline medical and administrative professionals. And I'd like to express my sincere appreciation to the three governments, especially health ministries, for the support. The virus has spread around the globe with over 10 million infection cases and over 500,000 deaths. Many people say that China, Japan, and Korea, CJK, have all successfully kept the outbreak under control, keeping fatality rate low, although the three countries took different strategies and measures. China took strong containment measures, including lockdown of large cities, and utilized big data to track patients and their contacts. Japan took the counter-cluster approach and created an easy-to-understand message for social distancing. They kept the rate of virus testing relatively low and successfully avoided the collapse of medical system. Korea is also known as a successful model for the government's proactive measures based on the lessons of MERS, utilization of ICT in tracing contacts, and effective nationwide cooperation. They had a relatively high rate of virus testing. In the triangle scheme of CJK, we have 21 ministerial meetings. Among them, Health Ministers' Meeting has been addressing infectious diseases since 2007. Even in the difficult time of COVID-19, 3 countries had information exchanges. And in this context, we have today's epoch-making webinar. The pandemic is still unfolding. Post-corona era has not come yet. We are still with corona. Recently, CJK all experienced sporadic increase. I hope the 3 countries' experiences can be widely shared in the world to flatten the curve on COVID-19. Now, speaker's introduction. We are very honored to have prominent leading experts of China, Japan, and Korea. Dr. Zunyou, Chief Epidemiologist of the Chinese Center for Disease Control and Prevention. Dr. OSHITANI Hitoshi, Professor of Tohoku University and a key member of Japanese government's COVID-19 advisory panel, heading the cluster-based approach. Dr. Hyukmin, Professor of Severance Hospital, Yonsei University, a special advisory member of the Korea Central Disaster and Safety Countermeasure Headquarters on COVID-19. All of them are playing a central role in each country to respond to COVID-19. Dr. KASAI Takeshi is Regional Director of WHO Office for Western Pacific. He is based in Manila. We have already received many questions. Thank you. And the window is still open. Please send your questions to the provided email address before the Q&A session starts. Yes, Excellency.
So, thank you. And we are looking forward to sharing with you the best practices of COVID-19 responses by China, Japan, and the Republic of Korea. To start with, may I now introduce Dr. Zunyou. Dr. Wu is a key member of the Chinese government's COVID-19 response team. He also plays an important role in controlling recent infections in Beijing. He has made significant contributions to China's public health policy against the SARS outbreak in 2003, as well as to prevent HIV/AIDS infection. Dr. Wu, the floor is yours.
Thank you for your introduction. Could I have my slides here with the screen? So my slide is remote controlled in the Secretariat. So could someone help to upload, share? We're waiting for assistant to upload the slides.
Okay, yes, yeah. So now you can start, Dr. Wu.
Yes, we're waiting for slides uploading. Can you hear?
Yeah. So I think the slides are up already on the screen.
We cannot see the screen. Oh, it's already there?
Yeah.
Okay, so I just go ahead to talk. Then you can, if you can see the screen, that's fine. It's my pleasure to share with you China's response to COVID-19 in China. So the next slide, slide number 2. I want to bring you back to a few months ago, the early events, to review you the early events that occurred in China. On December 27th, initial cases of pneumonia with unknown etiology was reported by Dr. Zhang Jixian. That report called Local Health Authority Attention. They issued alert on December 30th. Then December 31st, National Health Commission and China CDC involved in investigation. The early investigation identified most early cases had a common exposure to Huanan seafood market. Then they made a decision the market was closed immediately on January 1st. On January 3rd, even we do not know the pathogen for the pneumonia, we reported the epidemic information to WHO and also Japan and Korea. On January 7th, SARS-CoV-2 was isolated and identified as a pathogen for this epidemic. On January 9th, we reported to WHO this etiology assessment result. On January 10th, RT-PCR test kits was developed and sent to Wuhan for diagnosis. On January 11th, we start daily reporting epidemic situation to WHO. On January 12th, we shared the virus sequence with WHO. We uploaded the data to the WHO global database. That sharing makes all other countries to make diagnostic kits. On January 20th, COVID-19 was added to notifiable diseases in China. On January 23rd, Wuhan City was shut down. In the next few days, the other 15 cities in Hubei also locked down. Review the initial 3 weeks. We made very rapid response. It only took 7 days to identify pathogen for this outbreak. That may create the record in the human history responding to emerging infectious disease. It only took 2 days to develop diagnostic test kits. The most important scientific finding in the early response include virus isolation, identification, develop test kits, determine incubation period for the COVID-19, determine transmission mode for COVID-19. These 4 major scientific findings provide scientific evidence to develop control strategy for China and for the world. So that's a significant contribution from China contribute to the world, to the control of COVID-19 globally. Look back, in the initial stage of outbreak, 2 important bottlenecks. One is hospital beds, because in such a short time, large number of patients concentrated in the clinic cannot be admitted to the hospital. They can spread virus either in the community among our patients or among family members. Hospital beds become critical bottlenecks for control the epidemic. Second bottleneck is capacity to provide diagnosis. In order to respond to this outbreak, China uses that include universal measures, including mask wearing, hand washing, second, case identification, isolation, and management. To quickly diagnose the cases and isolate them from the community, from the family member, in order to stop transmission. Number 3, close contact identification and quarantine. Some of close contacts will be infected. If we do not detect them in the early stage, they may cause the continued spreading among the community. So the close contact quarantine is critically important to stop the epidemic. And number 5, movement. The epidemic movement. No movement, no epidemic. Movement restriction is very important to the transmission. Differentiation of levels of care and isolation for a high-risk group or people specific, we identify 5 categories. Close contactors, they may infected, may not infected. So those close contactors needed to be quarantined in home or hotel. In the early initial response, we encourage people close contactor use home quarantine. Later on, we find it's not a good idea because home quarantine cannot guarantee close contactors does not have the contact with other family members. Then we changed our strategy, use designated hotel for concentrate quarantine. The second category is suspected cases. Some may infected with SARS-CoV-2, some may not. They may just flu or pneumonia. And also, we made a mistake in the early response. We put suspected cases, more than one, in one ward. That's not right thing because some infected, some not infected, that will cause contamination or spreading among suspected patients in the same ward. The number 3, it's mild or moderate cases. They infected with SARS-CoV-2, but their symptoms are mild or moderate. So they do not need sophisticated care. So most of them only need some care. So they were put in the Fangchang Shelter Hospital. The number 4 is a severe case. The number 5 is a critical case. So these two categories, they need sophisticated health care. The larger proportion of cases consist by mild or moderate cases, account for about 80% of total diagnosis cases. Now, move to slide number 6, Fangchang Shelter Hospital. That's very important innovation of new idea. Create a shelter hospital is very important to respond to this outbreak. The shelter hospital have 5 functions. The number 1, isolation. That's the most important function. Isolation of milder, moderate cases is important to stop transmission. Number 2, triage. That's very supportive medical care. The military referral. That's very important to monitor the patient's symptoms. Because very advanced to the and the social engagement. The technology so it matches. Because you not need care, so only need a small number of care provide nothing of disadvantage. Because so many patients in the face guaranteed and also cannot eat individual demands. However, hospital innovation to response to the outbreak. Has played a critical role in control.
So slide number 9 update the epidemic of COVID-19 in China by June 28th. So the major outbreak was brought under control, only takes about 2 months. Then we have imported cases for about 2 months. Suddenly, in the middle of June, unexpected outbreak occurred in Beijing. Again, it started from a market. It's very similar to the original outbreak in Wuhan, seafood market there. So we try to identify what's the cause for this outbreak in Beijing. So we worked very hard from epidemiology, from environment, from virology, from a different perspective, trying to understand how this happened. So far, we have not identified what's the source of this outbreak. It's still mystery. We try to get an answer. It's very important. it now occurred in Beijing? Could it be occurred next in Shanghai or in the other cities? So we work very hard. We hope we will get an answer. By now, we have totally reported confirmed cases at 3,512 and suspected cases 10. We have also PCR positive 6,707. We have total days 4,634. The case fatality ratio 5.5%. Next slide, number 10. So the slide number 10 summarizes lessons we had that include science-driven response, as I described in the initial earlier event. The 4 scientific contributions, that's very important to develop control strategy. The number 2, core traditional public health measures that include mask wearing, hand washing, social distancing. Number 3, critical bottleneck, positioning and settlement. That is hospital bed capacity and capacity of. Number 4, community mobilization and response. Response to COVID-19 is for the people, by the people. Without community engagement, it's very hard to win the battle. The number 5, transparent public communication. From initial response, Chinese government, scientists are transparent to share information with international community, with the community in China. That's very important for public to understand what's going on and to get their trust, to get their support. The number 6, international cooperation. The number 7, leadership, coordination, and cooperation. And number 8, stronger logistical support. All these 8 lessons is very important, and use these 8 lessons. We brought the epidemic under control. We will use this to respond to the future epidemic. And look at that 8 experience could be divided by the 4 categories. One is 4 defense lines. In the initial stage, we treat response to the epidemic as a war. So we set our first defense line, Wuhan and Hubei. The second defense line, Beijing. The third defense line, Hubei's surrounding region. The 4th defense line, nationwide. The 4 earliest is very important. Early detection, early reporting, early isolation, and early treatment. Even a single case could cause an outbreak. So early identification of cases and to control, to making sure the patient cannot continue to spread the virus is critically important.
Yeah, Dr. Wu, so because of time, so I would like to wrap up
I'm almost finished.
In 2 minutes. Yeah.
Okay, yeah, almost finished.
Okay.
Yeah, the community engagement is very important, and the resource allocation. So all the response we based on the science. We have 2 important technical guidelines: diagnostic treatment protocol and prevention and control protocol. All this protocol updated very quickly. You can see the interval for updating the longest is only 15 days, about 2 weeks. The shortest, only a week, 6 days. So this means as long as accumulated knowledge, we immediately use that knowledge to guide our response. Now our strategy is to focus on prevention control, imported cases that including create no gap chain from border to community to the home. So at entry point, we have a screening strategy. Then we have quarantine policy for travelers. That's the end of my presentation. Thank you for your attention.
Thank you, Dr. Wu. Yeah, sorry, there was some connection difficulties in the middle. So thank you for your comprehensive presentation. The shelter hospital is a good example of swift response to a massive surge of patients. The 8 lessons learned and key experiences further provide important references on the holistic approach to fight the virus. For our next speaker, we have Dr. OSHITANI Hitoshi, professor of Tohoku University. Dr. OSHITANI leads the implementation of the cluster-based approach in response to COVID-19 in Japan. He also played a key role as a regional advisor at WHO Western Pacific Regional Office in the fight against SARS. Dr. OSHITANI, the floor is yours.
Your Excellency, thank you very much for your kind introduction. And I also would like to thank for organizer for inviting me for this important webinar. And it's my great pleasure and a great honor to share our experience with you. As you probably know, we are using quite unique approach for COVID-19, which is called as the cluster-based approach. And this approach is based on our epidemiological finding. So I would like to explain what we've been doing for COVID-19 in Japan. So can I have my first slide, please? Okay, next one, please. So COVID-19 and SARS are caused by similar virus, the coronavirus, but epidemiologically, the SARS and the COVID-19 are quite different. Also clinically, these two diseases are quite different. One of the most important differences between SARS and the COVID-19 is the clinical severity. For SARS, most of infected individuals had very severe illness, and the case fatality ratio was quite high. But compared to SARS, the COVID-19 is quite different, and many infected individuals, they are having just mild illness or even asymptomatic infection, which means the infected individual do not have any symptoms. So these characteristics of the COVID-19 that make this virus very difficult to control. But another important epidemiological characteristics of COVID-19 is it's shown in the graph below. The left below is how many people are infected from one infected individual. And actually for COVID-19, most of infected individuals do not pass the virus to anybody else. Nearly 80% of them do not infect others. But only small portion of infected individual infect many others, and causing the quite big super spreading event or the large cluster. This characteristics is similar to SARS. Also for SARS, the many infected individuals did not pass the virus to anybody else, and a very small portion of infected individuals pass the virus to many others. So this epidemiological characteristics of the COVID-19 led us to develop our cluster-based approach. The next slide, please. So due to this characteristic of COVID-19, without cluster or the super spreading event, the transmission cannot be sustained. So this is quite different from the infectious disease like influenza. For influenza, the many infected individuals infect others. But for COVID-19, if we do not have a cluster, the transmission chain cannot be sustained. So the cluster approach, we believe that the preventing the cluster, especially in the early phase of outbreak, that can result in suppression of the virus. That's the scientific basis for the cluster-based approach. Next slide, please. So to identify cluster, we are using the quite unique contact tracing strategy. I understand in many countries, they are only doing so-called prospective contact tracing, which means beginning with the newly confirmed cases, the close contacts are identified and followed. We are also conducting the prospective contact tracing. But in addition to prospective contact tracing, we are also doing retrospective contact tracing, which means that the past activities of infected individuals are investigated in order to identify the common sources of infection. So the retrospective contact tracing can identify the infections more efficiently than the strictly prospective contact tracing. This approach enables us more effective control of the COVID-19. Next slide, please. So by analyzing many clusters, by using the retrospective contact tracing, that we managed to identify the many clusters. So by analyzing these clusters, we found common characteristics for the clusters. And the most important common characteristics of the majority of clusters are summarized as 3 C's, which means the closed space, crowded places, and the close contact setting. So now we call this as a sanmitsu in Japan, and even small children know this word. And we managed to send more effective messages to avoid the risky behavior to the general public. And also, further analysis of the clusters identify additional risk factors, such as the exercise, the talking in loud voice, singing, and nightlife setting. So the nightlife setting is currently the source of infection in Tokyo and other places in Japan. The next slide, please. So this is the epidemiology of COVID-19 in Japan from January to June. Initially, we had the smaller outbreak between January and the mid-March, which was caused by imported cases, mainly from China. But since the mid-March, we had increasing number of cases, suddenly increasing number of cases, due to imported cases from many different countries, including European countries, the United States, Southeast Asian countries, and others. And that's why we had a very quite big outbreak from March to May. And state of emergency was declared on the 7th of April. but we managed to suppress the transmission since early April, and the state of emergency was lifted on the 25th of May. But this virus is very, very difficult to contain, and that we are still having the sporadic cases, and now we are facing to the new challenges, which is increasing number of cases associated, especially associated with nightlife, and particularly in Tokyo. And we are trying to control these outbreak associated with the nightlife. And we also are having many hospital outbreaks and the nursing home outbreaks. And in these settings, many elderly people are living. So that's why we are seeing the many severe cases and the deaths in these settings. And we are also trying to develop the new strategy to avoid such transmission to the hospital or nursing home settings. And we are using the new technology, including the mobile phone app and other technology like the rapid diagnostic test. And the next slide, please. So this is the comparison of the COVID-19 deaths and the deaths per 100,000 population in the G20 countries. As you can see, the China, Republic of Korea, and Japan are at the bottom in terms of the mortality impact. And these three countries are using the different approaches, but we have been successful in suppressing the transmission of the COVID-19 in these three countries. And I believe that it is important to share our experiences to fight against this virus in coming months or the probably coming years. And thank you very much for your attention.
Thank you, Dr. Oshitani. Indeed, identifying the virus's characteristic mode of transmission is crucial to suppress further spread. Specifically, Japan's cluster-based approach and the concept of 3 Cs offer valuable experiences to other countries to contain the virus effectively. Now, may I introduce Dr. Hyukmin, professor of Yonsei University, who has been emphasizing the need for long-term preparedness against COVID-19. Dr. Lee, the floor is yours.
Thank you for your introduction. My name is Hyukmin Lee and work for several hospitals as a rep physician for majoring on clinical microbiology. I am now reading COVID-19 task force in Korean Society for Laboratory Medicine. Please share my slide, please. It's my honor to be invited to this meaningful webinar for sharing Korean experience for diagnostic system for COVID-19. As all of you know, we have many valuable experience like the drive-through system or IT tracking system, but I don't have enough time, so I'd like to concentrate my presentation to diagnostic system in South Korea. As we all know well now, COVID-19 is caused by novel coronavirus called the SARS-CoV-2, which is named after SARS coronavirus due to genetic similarity. Regarding the origin of this novel virus, there are so many assumptions, but we don't have a correct answer for the origin of this virus until now. However, one bad coronavirus, which was reported in 2017, showed 97% of genetic similarity, and it is assumed that SARS-CoV-2 may be evolved from the common ancestor of this virus, called as RATG13. Next, please. After first report of the COVID-19, it became a pandemic in 3 months. Currently, more than 10 million people have been suffered from this novel infection, and more than 500,000 infected cases died. In South Korea, we suffered from large outbreak by Shincheonji Church in Daegu in February, but we could overcome that outbreak, and South Korea ranks 144th when we compare the prevalence per million people. In the process of overcoming the crisis, many things were important, including strong and transparent leadership of government in Korean CDC, and cutting-edge IT technology for patient tracking, and commitment from dedicated medical staff, and spontaneous module citizens, and so on. However, one of the most important factors is diagnostic system and capacity in South Korea. So I'd like to share our experience in this aspect. Next, please. All of the previous speakers said, like all of the previous speakers said, this notorious disease can be infected from asymptomatic patient or pre-symptomatic patient, and the rate of asymptomatic infection can be as high as 40 to 50%. According to Aaron's report in United States, about 60% of patients can be asymptomatic at the time of detection, and about 90% of patients can be converted into symptomatic patient in 2 days, but remain 10% keep their asymptomatic status until they recover. And both asymptomatic and pre-symptomatic patients can transmit their COVID-19 to other persons. Another characteristic of COVID-19 is very mild symptom, even in symptomatic patients. In early stage of COVID-19 pandemic, high body temperature, sore throat, and shortness of breath are well known as a triad to suspect COVID-19. However, it was reported that only 10 to 20% of patients may show these symptoms, and most of patients can show only very mild symptoms. So, screening of COVID-19 by symptom is very difficult, and all of these transmission can happen in very early stage by droplet transmission. Next, please. Because of these characteristics of COVID-19 in transmission, it's harder to screen by symptom in community. So the only way to detect patient is massive screening by epidemiological tracking. This is very important point. Next, please. So South Korean CDC decided to carry out 3 main components to contain COVID-19 in South Korea, including massive diagnostic testing, isolation and treatment, and finally tracking. All these 3 components should be performed like a chain. Diagnostic testing find the patient, and all patients should be isolated for treatment and prevention of transmission. And we find that epidemiologically related contact person to screen the COVID-19 by tracking. And all close contact personnel should be tested for COVID-19 whether or not they had the symptoms, because about half of a patient can be asymptomatic. To support this chain, we should establish the diagnostic system for COVID-19 under the concept of early implementation, maximum capacity for massive testing, exact testing, and rapid turnaround time. Next, please. Next, please. All these 4 concepts, early implementation to exact testing, is very important to contain the COVID-19 successfully. Because the transmissibility, I'm so sorry. All of these concepts is very important, but early implementation of a nationwide diagnostic system is the most important point to contain the COVID-19 successfully. Because the transmissibility of COVID-19 is so strong, so the number of patients can be doubled in every 3 to 7 days according to each country's situations. January 12th is the day when the first COVID-19 patients were confirmed in South Korea. So let's assume that we have 10 undiagnosed patients at that day. 10 patients can be 160 after 1 month if we adjust R0 from Chinese data. And this size of patient can be managed. However, after another month, 160 patient can be 2,560. And since this March 12th, 366 new patients can be happened every day. This size of COVID-19 burden cannot be managed by completely. But some of transmission can be controlled by routine tests, and epidemic can be decreased. But after 3 months later, since the first COVID-19 patient was diagnosed, you may have 40,000 of COVID-19 patients, and about 6,000 new patients can be detected in every day. In this time, it is impossible to contain COVID-19 by ordinary activity, and the only way to prevent from the spreading of COVID-19 is lockdown. So we should establish diagnostic system for massive COVID-19 testing as soon as possible. Next, please. This slide shows the result of our struggle to establish diagnostic system in Korea quickly. It is difficult to screen the patient by symptoms. So massive diagnostic testing capacity is required to detect COVID-19 infection. Before February 7th, only 18 public laboratories controlled by Korean CDC can test COVID-19. And the number of available tests may be 2,000 per day at the time. Since February 7th, 25 private laboratories started to perform the COVID-19 testing, and the capacity for COVID-19 testing expanded from 2,000 to 10,000 per day. The capacity of 10,000 is added over the 2,000 in public laboratory system and 8,000 in private laboratory system. We continue our struggle to increase lab capacity for COVID-19, and we can all about the 60,000 COVID-19 tests per day we can do on June 1st. June 1st, we can do the COVID-19 testing in about 55,000 tests in private area and 5,000 tests in public areas. Next slide, please. And this slide shows the capacity and the number of tests during February in South Korea. February 18th was the day when the first patient was diagnosed, and this patient was belonged to Sincheonji Church. After that, the number of tests dramatically increased, and we also tried to expand our capacity along this incredible test, and we are successful in expanding our capacity and diagnosed many patients in Sincheonji during the Sincheonji outbreaks. Next slide, please. And the third important concept is exact test. Generally speaking, 3 kinds of testing methods can be used to detect COVID-19, but molecular diagnosis is the most accurate and can detect asymptomatic patient. So we decided to use only molecular diagnosis after expert meeting consisting of Korean CDC and Korean Society for Laboratory Medicine. Next slide, please. In many countries, they want to use the antibody test because the antibody test can be done easily by forms of the self-testing. However, the sensitivity of antibody test is as low as 60% in 7 days after symptom onset. And this period is the time when the infectivity is very strong. So the false negative in this period is very critical to contain the COVID-19. So Korean CDC made a notice of emergency use authorization only for molecular diagnosis. So currently, only molecular diagnosis is used to detect COVID-19 in South Korea. Next, please. After all of this process, we finally have 2 laboratory networks. One is the private or clinical laboratory network, and another is public laboratory networks. Clinical private laboratory network is managed by the Korean Society for Laboratory Medicine. And this network is consisting of a secondary or tertiary care hospital and some clinical laboratory centers. And this system can handle the 55,000 tests a day. And turnaround time for in this network is about 3 to 24 hours. And most of the tests can be reported in 6 to 12 hours. Another laboratory network is public laboratory network. This network is managed by the Center for Laboratory Control of Infectious Diseases, KCDC. And this network is consisting of a Center for Laboratory Control of Infectious Diseases in KCDC and Research Institute of Health and Environment. And this network can handle the 3,000 to 4,000 tests per day. And this network also can report the result in 3 to 24 hours. So most of COVID-19 tests can be reported within 24 hours in South Korea. Next, please. To establish this Korean laboratory network, we must overcome some problems, including lack of positive control and so on. These problems were overcome through cooperation between Korean CDC and Korean Society for Laboratory Medicine. For example, external quality assurance is very important point to assure the lab quality. For external quality assurance, Korean CDC made positive control material, and this EQA was done by network under collaboration of academic society, like Korean Society of Laboratory Medicine and Korean Association of Quality Assurance for Clinical Laboratory. This both society is belonged to academic society in South Korea. Next slide, please. Another example of public-private collaboration is the emergency use authorization process for diagnostic testing kits. To establish the diagnostic system for novel infectious disease with various hospitals, the development of standardized commercial diagnostic testing kits is essential. In early stage of emerging infectious disease, but positive control or clinical sample for evaluation is very limited. So in South Korea, the evaluation for diagnostic testing kit have been performed by several laboratories, including one public and 4 private laboratories, using limited number of clinical specimens to maximize the accuracy of diagnostic testing kits during the EUA process. And the only testing kits show the same result by all laboratories is get the emergency use authorization. So only one test kit was get the emergency use authorization in early stage of COVID-19 response in South Korea. Next slide, please. Through this process, Korea has been able to build inspection capabilities, but these large-scale diagnostic capabilities is not available in all countries and or environments. So, in countries with insufficient molecular diagnostic capacities, COVID-19 infections may increase. And in this setting, it is very important to develop a diagnostic strategy that matches the characteristics of each country. So, in countries low molecular testing capacity, if they have the antibody testing capacity, and then they can use the initial antibody testing kit as a screening test. And in the case, the molecular diagnostic testing can be used as a confirmatory or antibody negative cases. And mass screening or pooling study also can be used in this low molecular testing capacity settings. And another good choice for low molecular testing capacity settings is the antigen testing. Even though we don't have the reliable antigen testing kits now, but antigen testing kits showed good specificity. So because if the antigen testing kit is developed, and then we can use it very efficiently. Next slide, please. And this strategy may be also developed by transmission scenarios, like the WHO strategy recommended strategies. Next slide, please. So this is my conclusion. COVID-19 can easily spread in community by asymptomatic infection. And 3-cycle for COVID-19 containment is very important because it is difficult to screen the patient by symptoms. And to complete this 3-cycle, early implementation and expansion of cost-effective COVID-19 diagnostic testing is very essential. And to make this diagnostic system, collaboration of private and public health system is very required to establish the capacity. Thank you for your attention.
Thank you, Dr. Lee. We appreciate your in-depth analysis on the diagnostic system for COVID-19. Indeed, the 3 T's, testing, treatment, tracking, are key to the containment of COVID-19. The early implementation of nationwide massive testing in Korea was particularly impressive. So last but not least, we have a special guest speaker, Dr. KASAI Takeshi, Regional Director of WHO Office for Western Pacific. Dr. KASAI, the floor is yours.
Thank you very much for your invitations, and it's my great pleasure to provide you a brief update on the COVID-19 situations and how we are responding to it. May I have our first slide, please? Can I have a next slide, please? If you could go back one slide backwards, thank you very much. The number of reported confirmed COVID-19 cases from the world continue to rise, and we've reached the green milestone of 10 million people infected and 500,000 lives lost worldwide. The pandemic is now hitting lower resources countries with fragile health systems that are less equipped to contain the virus. Infections are accelerating in many parts of the world. Next slide, please. If we see this by a 6 WHO region, while European regions, and then now maybe Eastern Mediterranean regions, downward or at least plateau, 3 other regions showing increasing a trend. In the Western Pacific region, most countries are seeing case numbers stabilize or decline. Some have had no new infections over a month, but there are countries with areas where we have observing ongoing outbreak or cluster. Although the number in the Western Pacific are smaller than other regions, the impact of this pandemic has been huge for families, societies, and economies, and people are anxious and fatigued. So far, countries in the Western Pacific region is suppressing the infection. We can't put our arms down. We still have plenty of space for virus to spread in the regions and around the world. And in this interconnected world, as long as the virus is circulating somewhere, no country is safe. We must stay vigilant and keep preparing for further surge of the virus. Next slide, please. WHO role in infectious diseases is defined in the International Health Regulation. Current International Health Regulation, IHR, is revised based on the lesson learned from SARS in 2003. The countries are mandated to share information of the event that can pose threat to international community, and WHO is expected to facilitate that. It was originally information on virus. But we quickly noticed that not just information on the virus, but information on intervention is equally important. We have been connecting member states and have been organizing regular sessions for facilitating sharing experience on response. We are also coordinating the research and development, including solidarity trial. Supporting countries, those who need help, is one of the most important functions of WHO. Based on those information we collected, and based on our experience and knowledge on the countries, we have been developing the guidance tailored to our region. And we are supporting countries in developing response plan, establishing testing and surveillance system, contact tracing, healthcare pathway, communication, and community engagement based on the guidance we received from our technical advisory group in the past. We are actually also doing something we have never experienced in the past outbreak response. Fight with misinformation. The rumor is spreading much faster than the virus. We're trying to work with the member states, countries, and partners to make sure that the people have access to right information. And because of the global gross shortage of the personal protective equipment, test kit, etc., we are also facilitating delivering those equipment to the countries. And so far, we deliver a PPE of 22 tons to 24 countries and testing kit to 10 countries in the region. We're doing this in partnership, and China, Japan, Korea has been a strong supporter for this. Next slide, please. Why our region has been able to suppress these infections? We have been looking for any intervention that is contributing or any factor. It is very important questions, we know, to find a way to prevent the further spread. And 3 countries, China, Japan, and Korea, experiences has been studied by many countries. But we found it is not that simple questions to identify the answer. Every country has a different background. In fact, our region is one of the most diverse regions, covering Mongolia in the north, New Zealand in the south, and French Polynesia in the east, and China in the west. Perhaps it's not a single intervention, but we think it's a bundle of intervention that makes differences. And those are public health intervention, including identifying the case and contact tracing, healthcare pathway to manage those cases, and the symptomatic and asymptomatic cases identified through the contact tracing, early non-pharmaceutical intervention, communications and effort to engage community, command and whole government approach, and also connecting a central and the local government to enhance this multi-sectoral approach. Next slide, please. One of the characteristics of this region is many countries introduce so-called non-pharmaceutical interventions, such as restricting the mass gathering or physical distancing or restriction of the movement control relatively early. This is a new virus, so we still don't know how each of those interventions being effective. But what I can say is that without these certain interventions, we might have experienced much bigger number of infections, and there might be more countries experiencing hospital overwhelming. But at the same time, we've been observing that significant impact of a society, life, and economy, particularly family and individual in the poverty. We have to find a way to do this better. Next slide, please. Next slide, please. When we think about the long-term strategy, obviously one important step is to continue to strengthen healthcare capacity and public health capacity, and to pay attention how to protect the vulnerable. And the other is continue to adjust those non-pharmaceutical intervention according to epidemiological situations. And when we think how to live with this virus, I think it is a mistake to prioritizing either health or livelihoods. It's actually about improving both. And decision about how to do this in different contexts need to be based on the data and they need to be made by bringing together the health sector, economic sector, and community at one table. The key is individual willingness to maintain healthy practices to protect not only themselves, but their families, colleagues, particularly the vulnerable, including the healthcare worker. The key is business sector to find a way to operate to minimize the risk of infection. And the key is the government to develop the policy and implement the policy to support the individual and business sectors. Next slide, please. If we do this well, we can protect ourselves and each other from these diseases, but also other threats. We can grow from the new normal to a new future where health is recognized as an investment, where healthy people in our communities achieve their full potential and where inequalities are minimized. This is good for all of us as individuals, but also for our economies and societies. This new future is the dividend of COVID-19, which WHO hopes for, and looking forward to working together with the partners and member states. We are now at the decisive moment. We must stay vigilant and keep preparing for further surges of the virus so that together we make our way to this better future. Thank you very much.
Thank you, Dr. KASAI. Certainly, WHO plays an important coordinating role in COVID-19 response, especially on technical cooperation and facilitating information sharing among countries. The fight against the virus is going to be a long battle, and we are all have the responsibility to make our societies and health systems stronger to create a better future. Thank you all for your presentation. And now shifting gear at this point, we move on to the Q&A session. So Secretary General Michigami, please, like to ask you to take a lead.
Thank you, Excellency. So let us now move on to the Q&A session. We have received over 300 questions from many countries. Thank you so much. And here I'd like your understandings that due to time constraints, we cannot address all of them. I would group them into 6 to 7 questions. And here, in addition to the 3 panelists, we have Dr. Wan Kui-chang, Director of Infectious Disease Department, Peking University First Hospital. So let's go on to the first question. This is for Dr. Oshitani and Dr. Lee. In many countries, medical standards are not as high as China, Japan, or Korea. These countries are suffering a lot. So can you give advice to these developing countries or low-income countries where health system and economic basis are relatively weak? In these countries, they don't have many hospitals or doctors, and perhaps their sanitary standards are not good enough. So I'd like you to give them helpful or realistic advice. I don't know, mask wearing or social distancing or whatever. So first, Dr. Oshitani, can you try to answer? Thank you.
Thank you very much for your question. And it's very difficult question to answer. I know that many resource-limited countries are experiencing the very difficult situations, and that therefore the key success, for Japan's success, that depends on the good healthcare system. we have a good healthcare system, and almost everyone can access to the good healthcare system. That's why we managed to identify at least most of severe cases without the huge PCR capacity. We've been very cautious in expanding the PCR capacity because of the quality of testing and other issues. But now that we are expanding the PCR capacity, but in the initial stage, we have a very limited PCR capacity, but still we managed to identify the majority of severe cases, thanks to this good healthcare system. And so these countries with limited resources need to further invest into the healthcare system. And also there is no one size fit type of approach for this virus. And every country is using the different approaches. The China, Japan, Korea are using the different approaches. And the different countries are having the different settings, the different stations in terms of the epidemiology. So they probably need the different strategies for this virus. And we are happy to help these countries to provide some advice based on the experiences. Thank you.
Thank you very much. Then Dr. Lee, please.
At first, I agreed with some different strategies should be applied, especially in the diagnostic strategy by each country's situation. And epidemiological tracing, but epidemiological tracing is particularly important to determine the subject of testing. And also isolation is one of the main tools to contain the COVID-19. And then diagnostic strategy is important. But diagnostic strategy may be difficult according to the capacity for molecular diagnosis. So in low molecular diagnostic capacity, initial screening can be done by antibody tests, even though they have low sensitivity. But to save the molecular capacity, antibody testing can be used. And antibody negative subject can be tested by molecular testings. And another solution may be the pooling test. Pooling test can be used for developing countries. In South Korea, pooling technique is also used for mass screening in some hospital or long-term care facilities after validation by our clinical society. And we use it without the loss of sensitivity in mass screening. So I don't know what is the exact answer, because everybody have their situations. So in each country, they should develop their strategy. That's my answer.
Thank you very much, Dr. OSHITANI and Dr. Lee. Question number 2. This is for Dr. Wang, Dr. OSHITANI, and Dr. Lee. China, Japan, and Korea have much smaller number of deaths and infection cases. Some people say that in East Asia, there is a factor independent of government measures, and some call this factor as factor X. The question is, what will the factor X be? I know you experts and your governments have been doing all good jobs in 3 countries. I agree, and many people will agree. But I also think that there are some other factors other than government measures. For example, high hygienic standards or social discipline or some cultural practices. For example, in East Asian countries, we don't often hug or kiss. We have maybe smaller number of family gathering compared with Europe or Latin American countries or Middle Eastern countries, or some mentioned BCG vaccination. So can you try to explain what this factor will be? First, Dr. Wang, please.
Okay. Okay. Can you hear me?
Yes.
Yes. Okay. Thank you for your question. It's my pleasure to join this webinar. This question is very interesting. I think for China, Japan, and Korea, so all these good basis of the healthcare system is important, I think. Besides the government measures, you mentioned a lot. I think it's a culture, I think. It's the first of all is the people's compliance. It's good. It's good enough in these three countries. For example, the government asked the people to take the mask and the social distance, hand hygienes, and stay at home for isolation, etc. All these measures have been implemented in these three countries. I think this is the first thing, and the second thing, I think this about this customs. These three countries, they didn't gather together very often. At this special situation, they just stayed at home. In China, all the people stay at home, isolate themselves. This is an important issue. And another one is, I think, is all the expertise mentioned about this, the case tracing, contact tracing. This is kind of for government measures, but these measures has been implemented very seriously. This is another important part. Just mentioned yesterday, WHO mentioned about case tracing is very important to find the infectious patients and isolate them and keep the transmission stop. Thank you.
Thank you. Dr. Oshitani, please.
Yes, this is a new virus, and there are still many unknowns, and there could be some important factors which are not known, but which are associated with the relative success in these three countries. And we have to explore many different possibilities, and social, cultural, and behavioral aspect may be important. We declared the state of emergency, but all the physical distancing measures were the voluntary basis. We did not force the people to stay home, but it's a voluntary basis. And we also did not force to close the shops, restaurants, and it's again the voluntary basis. But in Japan, the majority of people implement the measures to avoid the transmission, and this kind of aspect in this part of the world that may be important, and we also need to explore some other possibilities. Thank you.
Thank you very much. And Dr. Lee, please.
I'm so sorry. I don't know why my mic is muted. I agree with my previous speaker's opinion. Some people say that BCG vaccination may be factor X, but I don't know. But however, rapid detection and early treatment seems to be associated with good prognosis according to our experience, because the total death rate is very rare in South Korea. And also the death rate in each age group is also very lower than other countries. So we think the rapid detection and early treatment may be associated with the good prognosis. In South Korea, most of COVID-19 patients have been diagnosed within 2 to 4 days after symptom onset, and So most of Korean patients can be treated as soon as possible after symptom onset. So I think that this rapid diagnosis and start of treatment may be a role in decrease the mortality. That's my opinion.
Thank you very much, Mr. Lee, Dr. Lee. Next question number 3. This is a relatively quick question and answer for, again, I'm sorry, for Dr. Oshitani. Both Japan and Korea have been managing the pandemic relatively well without lockdown measures, but the two countries took different strategies for the PCR virus testing. In Japan, you have low rate of testing. In Korea, you have relatively high rate of testing. How do you see this difference, Dr. Oshitani?
Thank you very much. Again, as I said before, we are using the different strategies in terms of testing and other measures, and there is no one size fit all type of the solution for this virus. And we had the limited the PCR capacity, but we needed to develop the effective the control measure based on available the resources. And every country have to they try to develop the best strategy based on available resources. And the solution for the testing is although we had a limited the PCR capacity at the beginning, we managed to identify the cluster to develop the cluster-based approach, which does not need the massive testing. Without massive testing, we can manage to identify the many cases. So we have different approaches, but all countries are trying the best to minimize the impact. And at least so far, these 3 countries are being successful in suppressing the virus transmission by using the different strategies.
Thank you, Dr. Oshitani. So, Dr. Lee, do you have something you want to add or respond?
It's very difficult because Dr. Like the Dr. Oshitani's opinion that every country has its own situations. So in our country, we can make the diagnostic system as soon as possible, so we can use it to find the many patients. But the post-outbreak setting is very different between 2 countries. We faced the large outbreak in Sincheonji Church in Daegu in early stage of in South Korea in early stage, and then our big capacity for rapid diagnostic testing is make a crucial role in the stage. But in Japan, they faced another situation. So I don't know what is the difference between the 2 countries. But our diagnostic capacity is very important point in our country's situation.
Yes, indeed. Thank you very much, 2 doctors. And next question 4. Let me welcome one participant from the Philippines to ask a question. This will be for Dr. Wang and Dr. Lee. So please.
Okay. The Philippines just recorded the highest new cases in the past weeks after we released social and economic restraints, and we haven't flattened the curve. I think many countries are in similar situations. Can you give some more suggestions or advice to developing countries like ours?
Okay, thank you very much for your very important and succinct question. Yes, indeed, many countries are facing this difficult situation now. and maybe China, Japan, Korea are not the exception. So how to balance between protecting people's life and economic activities. So we have to open the door and close the door again and open, or tighten the restraint and loosen. We have to repeat the same thing. So first, Dr. Wang, can you answer this question?
Okay. Thank you for the question. It's all we face the similar things. I don't think it's a shortcut to prevent the pandemic. And the COVID-19 infection should be normalized life status. So for prevent the spreading and the outbreak, I think first of all, we should keep the measures, all the measures, including the wearing the mask, the long social distance, and the hygienes, hands hygiene, etc. All this is important to prevent transmission so far. And the second thing, in my opinion, that's the early finding and early diagnosis for the cases. This early finding, early diagnosis depends on the detection. The nucleic acid detection is very important. A key issue to prevent the transmission and outbreak. And another thing I think is the case tracing. The case tracing is sometimes difficult to do, but you have to do this case tracing very seriously and get the close contact patients, people isolated effectively. So this is the way to in the so-called common situation of the even in returning the business and the working, you have to take. Thank you.
Thank you, Dr. Wang. And Dr. Lee, please. Sorry to ask you so many questions.
I don't worry. I'm so sorry for the fertility situation, but in my thought, I also think there is no cost to make the epidemiological flatten. Each country has responded to COVID-19 using many methods, but the method can be divided into two categories. One is the massive testing and isolation, and another is lockdown. I don't know which method is more appropriate for your countries, but you should choose each of one. And another important strategy is mass masking. About 50% of COVID-19 patients may be asymptomatic. So mass masking is very important tool to stop the spreading of COVID-19 from asymptomatic patient. So I would like to recommend the mass masking for Philippines.
Okay, thank you very much to doctors. Next question, question number 5. This is for Dr. Zunyou and Dr. OSHITANI. When does the next big wave come? And when will an effective vaccine be available? Simple but very important question. We've received this question from so many participants. So can you first try, Dr. Wang? Sorry, Dr. Wu.
Thank you for that question. In terms of second wave, actually globally, we are still in the first wave. It's still epidemic period. It's continuing to increase. So each day we have over hundreds of thousands of new cases infected. It's only a few countries brought the epidemic under control, such as China, Japan, Korea. When all of 3 countries talk about second wave, that's possible. And for the other countries, the epidemic are ongoing. So the epidemic could be get even worse if you do not implement the prevention program thoroughly. So, for example, just like take United States as an example. So the reopen or economic, they do not have good control. The number of cases, new cases, suddenly increased in the past few days. Even in China, Japan, Korea, if we do not implementing the program consistently, the epidemic could be coming back very quick. So in the winter, it may be even worse. For the vaccine, I think it provide promising hope. Optimistically, it could be ready for use at the end of this year. Thank you. Over.
Thank you. Dr. Stanley, please.
Yes, we are not sure when next big wave come, but at least the previous big wave was triggered by the many imported cases from different parts of the world. And if we open the border now, without proper planning, we may have another big wave. So we have to have the proper planning in opening the border. We have to open the border, but we cannot close the border for many years. So we have to open the border, but when we open the border, we have to be very careful. And we are not sure if this virus follow the similar seasonality with influenza and other respiratory viruses. But we have to be prepared for the coming winter, and so using the period with the lower number of cases, we should develop more effective control measures during this time. And for the vaccine, we are not sure. There are some promising vaccines. They're also in Japan, but we are not sure if the safe and effective vaccines will be available in near future. Even the vaccine is developed, we need to deliver the vaccine to the many people in the world. Mm-hmm. It takes more time, and the developing the vaccine does not provide the solution, the immediate solution. So we have to develop our more effective control measure for coming weeks or coming months to be prepared for the next the wave. Thank you.
Thank you very much to doctors. So for the time being, we have to live with COVID-19 for several coming months or even a few years with wisdom. And next question, let's welcome another audience in China.
Hello. Good afternoon, distinguished panelists and the host. My name is Ming Chi, and I am a PhD student at Tsinghua University in Beijing. My question would be, China, Japan, and the Republic of Korea have developed a trilateral cooperation scheme to address infectious diseases, and it is always useful to obtain information on cases and treatment from other countries. So my question is, what aspects of trilateral cooperation on infectious disease need to be strengthened in the near future? This question is open to all panelists, and thank you for giving me the chance to answer this question.
Thank you very much for a good and very important question. So, as she said, law is open so that any doctor volunteer to answer. Or for the time being, until somebody is appearing, let me briefly say that I think there are two aspects for trilateral cooperation. One is the communication or cooperation among you, experts or doctors, What I know is that you almost always keep good communication among three countries, but maybe there will be some room to further strengthen. And second one is broader cooperation among government officials, especially of health ministers. So as I said in the opening remarks, we have trilateral health ministers meeting, and that is a indispensable foundation of today's webinar. And clearly, we want to strengthen the cooperation, close cooperation, so that anybody try to answer to strengthen the communication or collaboration or cooperation among three countries?
I think it's very important, particularly for China, Japan, and Korea. We are three countries that have early epidemic and all brought under control. As one of guests just said, we cannot close the border for the rest of the time. The border will open. Then a few areas I think we could strengthen the collaboration. As you just mentioned about information sharing, in the early epidemic, we shared our information with Japan, with Korea, once even we do not know the etiology. Then I think scientific research can collaborate to understanding the virus, to respond to the epidemic. Third is government collaboration for the future, how to respond to this epidemic, particularly when the border open, we have more exchange among China, Japan, and Korea, how to set up agreement, the common control strategy we shared, and we can keep the economic and social life back to the normal. At the same time, we can control the epidemic at the minimum level. Thank you.
Thank you very much. Very constructive answer. Okay, this will be almost the end of the Q&A session. But just before closing, Dr. Wu, Dr. Oshitani, Dr. Lee, I'd like you to talk briefly something, anything, or any message which you didn't have time to touch upon. So how about Dr. Wu?
To give last minute, I think we need more collaboration like this exchange. In the future, this frequency will be increased, and we hope we'll work with you in the future more. Thank you.
Thank you very much, Dr. Oshitani.
Yes, as Dr. Wu mentioned, we need the more collaboration. Although the borders are virtually closed, we have internet, and we have this kind of the web, based the conference system now, and we can have more collaboration in the field of public health, the clinical management, clinical field, and also the biological and the scientific field. And we should strengthen our collaboration between countries, especially among these three countries. And so I would like to thank the organizer for this opportunity. It's also a very important opportunity for us to learn the lesson in the Republic of Korea and China. And we need to have this kind of opportunity more often to share our experience. Thank you.
Thank you, Dr. Lee.
At first, thank you for your invitation. I agree with all speakers' opinion because the South Korea, Japan, and China is very closely connected in many ways. So one country's crisis became another country's crisis in short time. So we need to keep our connection more tightly. So thank you for your invitation repeatedly.
Thank you all three or four doctors.
Okay.
So,
can I have a comment? Can we?
Sorry, yes, please.
Yeah. Okay. I have a comment. Maybe we can set up a scientific committee or group among these three countries to get regular meetings to discuss COVID-19. Thank you.
Thank you very much.
Okay, thank you. And with these insightful and rich exchanges, we bring the webinar to a close. As I mentioned at the opening, solidarity and cooperation are the keys to fight the virus and build back better together. In this regard, the webinar was indeed a fruitful and productive discussion. It illustrated the importance of knowledge sharing and how much we could learn and benefit from each other. We'd like to extend our deep appreciation to our panelists, my sincere gratitude to our partner TCS, who made this webinar a success. Thank you as well to our participants who sent questions and all of you who have been with us in the last few hours. We received many questions from our participants and we greatly appreciate the interests. We would endeavor to summarize the queries as well as provide appropriate references in response. On this note, please check the webinar's events page for further details, including the presentations given today. We hope you could also provide your comments through evaluation survey. Thank you. Now, let me invite Secretary General Michigami to give closing.
Also, thank you to all the participants. Okay. It was the first time for TCS to organize a webinar. I appreciate Dr. Gambold and UNESCAP for generously offering the technical equipment and skills. Today, I found nobody is arrogant or complacent. Every panelist are so modest. That was quite impressive to me personally. So COVID-19 is spreading beyond the borders. And our responses should also be beyond the border or international. And in this way, in this direction, we can navigate through this difficult time. I hope today's webinar will be useful for many people, many countries. All presentations, documents, materials will be posted on TCS webpage. Keep safe and healthy. Thank you very much.